This is the second cervical vertebra. Second cervical vertebra is also called the axis vertebra. And how to identify this is a cervical vertebra? Due to the presence of the foramina transversarium. They are present foramen in the transverse process. This is how we identify this is a cervical vertebra. Now, how to identify this is the second cervical vertebra or this is the axis vertebra? By the presence of this odontoid process. This odontoid process represent the centrum of the atlas. Centrum of the atlas mean it is developed from the body of the atlas bone. We saw that atlas bone has no body, no spinous process, and the body of the atlas bone develops into this odontoid process. Now, anatomical points of the second cervical vertebra. Odontoid process, the bony projection from the body of the vertebra lies in front and above. The superior articular facet lies superiorly and inferior articular facet lies inferiorly. This is the bifid spinous process. The bifid spinous process lies posteriorly. This is the anatomical point of the second cervical vertebra. Now we will learn about the ligaments present in the second cervical vertebra. On the tip of the odontoid process, they are present apical ligament, and on the each side of the odontoid process, they are present alar ligament. And on the body, anterior aspect of the body, they are present anterior longitudinal ligament. On the posterior aspect of the body, they are present posterior longitudinal ligament. And posterior aspect of the body te aro duita structure present thake, egulo hocche transverse membrana tectoria and the vertical limb of the cruciate ligament. Membrana tectoria and vertical limb of the cruciate ligament, these are the two structures present in the posterior aspect of the body. Then in the spine, the ligament present, ligamentum nuchae. In the lamina, these are the lamina. Laminate ligament thake, ligamentum flavum. Now, what are the joints of the second cervical vertebra? Second cervical vertebra, the odontoid process of the second cervical vertebra articulate with the first cervical vertebra. They are present facet in the posterior aspect of the anterior arch. Posterior aspect of the anterior arch of the first cervical vertebra. This is called facet for the dens. It articulates with the odontoid process like this. It articulates with the odontoid process and forms median atlantoaxial joint. This is median atlantoaxial joint. It is a pivot variety of synovial joint. And the superior aspect of the second cervical vertebra articulate with the inferior facet of the first cervical vertebra and forms lateral atlantoaxial joint. This is a plain variety of synovial joint. This is a plain variety of synovial joint. This is pivot variety of synovial joint. And the inferior facet. These are the inferior facets. This inferior facet of the second cervical vertebra articulates with the superior facet of lower cervical vertebra and forms this joint. This is a intervertebral joint. This is a secondary cartilaginous joint. Now we will learn about the muscle attachment. The muscle attached with the transverse process are levator scapulae, scalenus medius and intertransversaria and scalenus cervicis. These are the muscles present in the transverse process. The muscle present in the spinous process. The spinous process is bifid. The muscles present in the spinous process are rectus capitis posterior major, obliquus capitis inferior, semispinalis cervicis, interspinal cervicis and multifidus. These are the muscles of the spinous process. And on the body, On the body, on each side of the body, lateral to the anterior longitudinal ligament, they are present longus colli muscle. And this is all about the second cervical vertebra. Thank you.